body is home to about at least 1,000 species of bacteria that live in a friendly consortium with us. In fact, we depend on them. But there are a few errant species that compete aggressively and lead to illness. Bacteria that cause infections we're more familiar with in this country. So when people get pneumonia or sepsis or urinary tract infections, and we assume there's a pill for that, and up to now there has been, but it's increasingly becoming the case that there is no treatment. So it's estimated right now that almost 100,000 people a year die in American hospitals from infections that are resistant to any antibiotic available. And this is starting to be a problem in the community, meaning that people who have not been in high-intensity hospitals where there's a lot of antibiotic use, people just going about their business, get pneumonia or skin infections, and there is no treatment. And because there's no name for this, there's no single group that's affected, there's no lobby, there's no agency that speaks for them. People are not aware when this happens and strikes a family. They're not aware that it's happening all over the country to many, many people. We've come to learn that there's a much larger problem than the so-called neglected infectious diseases. It turns out that the problem that people who live in economically disadvantaged areas of the world face with diseases like tuberculosis and malaria, that is the lack of adequate pharmaceutical research and development, has merged with the problem in countries like ours, where many of the drug companies have retreated from antibiotic research and development over the last couple of decades. And for a variety of reasons. Some are scientific, some are economic, some are regulatory, but the bacteria haven't given up. They're very good at evolving resistance to antibiotics. And so we're successively emptying out our medicine chest of useful antibiotics as resistance spreads. So I actually think this has become an urgent issue for the whole world, that we're all united in the need for finding new, more effective ways to develop anti-infectives. And tuberculosis just is the stalking horse for our lab in this problem. But we're actually hoping to illustrate fundamental new ways of thinking about the general problem. What we did in our Gates Foundation supported high-throughput screening work for new compounds that kill tuberculosis, Mycobacterium tuberculosis, is to begin with known drugs for other purposes. And this is not a new idea. It's called repurposing. The idea is to take compounds that already passed all the tests about how to be safe, relatively safe and effective for some purpose in humans. So we know a lot about them. They've been used extensively. If there are side effects, we know what they are. We know who's likely to get them. And then it might be the case that they can be brought back to be used in a new way. So we screened thousands of old drugs, and we found one, an anti-inflammatory, used by hundreds and hundreds of thousands of people for many years, that is effective at killing Mycobacterium tuberculosis. And this will get a little technical, but it's particularly effective when the bacterium is not dividing. And it's one of the major goals in our lab to find antibiotics that kill bacteria that are temporarily not dividing. These turn out to be the ones that are really hard to kill with conventional antibiotics. They're really smart. So they have an insurance policy against us. Some of them voluntarily refrain from dividing. And all our antibiotics were developed against dividing bacteria. And it turns out they don't work very well against non-dividing bacteria. So they learned the trick of keeping their head down before we were walking the earth. And we found that it is possible to find compounds that kill the non-dividers. So anyway, one of these is a drug that costs 2.5 cents. It's off patent. It's really easy to make. It's widely available. It's widely used for aches and pains in many parts of the world. And we even found old papers going back 40 and 50 years where when this drug was introduced, people tried it in patients with TB because they have aches and pains and were amazed at how much better they got from their TB, but they didn't connect the dots and think, well, maybe this drug is actually killing the TB. So that could be a fast track to a new TB drug. And we're screening millions of compounds. Whether or not we find more compounds ourselves, what I really hope we can do is share with anyone who's interested the way of looking for them, the way of looking for compounds that kill bacteria both when they're replicating and when they're subjected to immune system pressures that keep them from replicating. So that's part of our message.